Hello, everyone, and welcome to Show+Tell, New Jersey. Today's program will showcase 12 organizations working to improve health and well-being for children and families in New Jersey. My name is Karen Lien, and I'm head of programs at Promise Venture Studio. Over the past few months, my colleagues and I have had the great honor of getting to know each of the programs you'll see featured here, and we're so excited to introduce them to you today. Today's event is hosted by Promise Venture Studio and the Nicholson Foundation. Promise is a nonprofit venture studio that attracts, supports, and connects mission-driven entrepreneurs whose work impacts children ages 0 to 5 and their families and caregivers. We have a special focus on innovations impacting children and families facing the greatest adversity. We also put equity at the center of our work because we recognize that opportunities are unequal. Structural racism and other systemic inequities are the root causes of the obstacles we exist to overcome for children and families. We seek to proactively build programs, a team, a venture community, and an innovation ecosystem that are anti-racist and anti-bias. Today's event is part of a series of show-and-tell programs that we've created with the intention of building connections between impactful organizations and funders and other leaders within the field. Show+Tell New Jersey is our first ever regionally focused event, and it's our first event that looks beyond early childhood to encompass whole family health and wellness. We're able to take this broader view because we have the expertise of our co-hosts for Show+Tell New Jersey, the Nicholson Foundation, who handpicked this group of innovative programs in New Jersey. Now it's my pleasure to introduce two of our partners at the Nicholson Foundation, Shannon Riley Ayers and Barbara Kang. Shannon and Barbara will tell us a little bit more about their foundation's history and philosophy and their motivation for highlighting this group of programs at Show+Tell.
Hi, and welcome to Show+Tell. I'm Shannon Riley Ayers, a Senior Program Officer at the Nicholson Foundation.
And I'm Barbara Kang, also a Senior Program Officer at the Nicholson Foundation. Today, we are excited to introduce you to 12 of our dedicated grantees, their promising programs, their potential for positive impact, and the urgent need for sustaining their work because the Nicholson Foundation is sunsetting this year. The organizations that you will hear from today share the Nicholson Foundation's dedication to improving the health and well-being of vulnerable populations in New Jersey, particularly through the health and early childhood systems. Each of these partners are seeking funding to support their ongoing work as they pursue greater impact and ultimately long-term financial sustainability. We encourage you to consider the role you can play in supporting these organizations.
The Nicholson Foundation has a 20-year history of grant making. By the time we close our doors, the Foundation will have granted nearly $150 million for project support and direct technical assistance to grantees, largely in New Jersey. Many of the organizations we have supported over the years have achieved sustainability and no longer need our grant funding. The organizations you'll meet today are 12 of our newer grantees who have not yet had enough time to fully develop a strategy for financial sustainability. We are hosting this event in partnership with Promise Venture Studio to help these organizations identify new partners to support their work. So we're glad you've joined us today for Show+Tell. We are certain you will be impressed by the dedication and commitment of our grantees. We know you will be eager to hear more about each project, so we encourage you to click the Connect button to express your interest. We hope you can find a way to amplify the impact of these organizations with your partnership and funding. If you have any questions, please reach out to our foundation and we will be happy to talk with you. Thank you for your commitment to health and early childhood.
Thanks so much, Shannon and Barbara. As Shannon described, we've intentionally designed Show+Tell to catalyze connections. So let me tell you briefly how that works. Each of the programs we'll feature today will give a short presentation, just 3 or 4 minutes. And after each presentation, you'll see a poll pop up on your screen asking if you want to connect with the speaker. When you say yes to the poll, then we'll share your email address with the presenter and they'll contact you to share a little more information, more than they could fit in their 3-minute presentation. We'll also send you contact information for every organization you request to connect with. So clicking on these pop-up polls is not a big commitment. It's a next step towards learning more. We've also created a web page where you can follow along with the presentations today if you'd like to keep track of the lineup there. You can use the links on that follow along web page to request connections as well, if you'd rather do it there than on Zoom. All of these ways of connecting are opportunities to increase the collective impact of our community. So I ask and challenge everyone today to think about what you can give through this forum, whether it's feedback, a partnership proposal, an investment. What role can you play? With that in mind, let's get started. The organizations you'll meet today are coming from all corners of New Jersey and are taking on diverse challenges. Some are serving specific regions, as you can see highlighted on the map on the left, and the programs on the right are focused statewide. As Barbara shared a few minutes ago, all of these initiatives are funded by the Nicholson Foundation. We've organized today's presenters into 4 thematic groups. We will start by hearing from 4 programs that are innovating in healthcare delivery. Then we'll introduce 3 programs working to address the social determinants of health in New Jersey communities. Next, we'll hear from leaders of 3 community-based organizations that are serving children and families impacted by adverse childhood experiences, or ACEs. And then we'll end with 2 really powerful programs addressing early care and education. So we'll get started now with our organizations working to improve healthcare delivery and health outcomes in New Jersey, with a special focus on better serving those who face the greatest adversities. Our first presenter is David Kim. David is Director of Innovation at St. Joseph's Health, a safety net hospital system in Paterson. In just 2 years, David and his team have built an exciting program that is improving outcomes for patients. Here he is to tell you more.
I'm David Kim. I lead innovation at St. Joseph's Health, a nonprofit hospital system with the mission to care for the vulnerable and underserved communities of northern New Jersey. Well-resourced medical systems have departments dedicated to innovation, but safety net hospitals, which work most closely with vulnerable communities, rarely do. As a safety net hospital, we were only able to open a Center for Innovation through the support of the Nicholson Foundation. Our approach has to be different. Our staff are dedicated and mission-driven, caring for some of the most complex patient cases. They don't have the luxury of time or tools to regularly bring great insights to life. Our center uses a rapid cycle, human-centered process that is inclusive of our communities while providing tools that empower even the most time-stretched employees. Let me give you an example of this rapid cycle innovation. Back in April 2020, no one knew much about COVID. Our frontline workers were sleeping in their cars, afraid of passing the disease on to their families. In 24 hours, we had a mission, a team, and an infrastructure. In 48 hours, we met with employees, launched an accommodation service, and prototyped digital tools. Within 1 week, we built an easy-to-use, robust online service housing nearly 200 employees. By the end of the accommodation service, we had a 99% satisfaction rate. Nearly 80% of employees experienced an improvement in stress levels, and over 2/3 reported lower anxiety. While COVID accelerated our growth, our initiatives extend well beyond. From co-creating prenatal services with women of color to developing a better experience for cancer care, we've applied our methods to many types of problem spaces. So how does it work? Most leaders, when faced with a problem, jump to a solution. Instead, we go to those affected by the problem and allow their insights to lead us to the solution. We take validated methods like lean and design thinking and adapt them for our overstretched hospital staff. One example, bite-sized, just-in-time tools called microsprints. In short 15 to 30-minute sessions, we develop implementable solutions to real-world problems. One of our physician leaders with over 30 years of experience describes it this way. We used to build solutions in an ivory tower and tell the community what they need. Now we ask what they need in order to build the solution together. There are so many doctors, nurses, support staff, and community members across the country stretched thin just like ours. Innovation has the capacity to quickly tap into the insight from underrepresented voices, building a bridge to tangible solutions. Lacking the resources of a major system, we're looking for partners and funders to join us. We've only been able to do this because of partners like you, to flip the way we solve problems, to advocate for participation, to uplift our safety net hospitals. Why should our communities deserve any less?
Thank you so much, David. Now you should see a pop-up on your screen inviting you to learn more about the Center for Innovation. If you click yes on the pop-up, then we'll share your email address with David and he'll follow up to tell you more. Next, we'll hear from Lisa Asari, Assistant Commissioner of the New Jersey Department of Health, who will talk about a new initiative with great potential to improve health outcomes and reduce racial disparities for new moms and babies. Here is Lisa.
Black and brown communities across New Jersey have made abundantly clear the interventions that would reduce disparities in maternal and infant health outcomes. More support for mothers in navigating pregnancy, childbirth, and parenting. The answer for this? Community doulas. Doulas are trained professionals who provide physical, emotional, and informational support before, during, and after childbirth. Multiple studies show that doula care can improve maternal and infant health outcomes. They are trusted members of the community and often offer services at low to no cost. After 4 successful doula pilot projects in cities across the state, projects so successful that legislation was passed allowing Medicaid to reimburse doula services, we are now ready to launch a first-of-its-kind workforce development organization for community doulas. Hi, my name is Lisa Asari, and I'm thrilled to tell you about the Doula Learning Collaborative. Currently, there is no organizational body that supports workforce development for community-based doulas. They, like other medical professionals, want training, professional development, reflective supervision, and assistance solving problems that arise in their work. They feel like they're on an island by themselves, with no organizational structure keeping them abreast of best practices, industry updates, trends, lacking connection and community. This is where the Doula Learning Collaborative comes in. Just as doctors have the Medical Society of New Jersey and nurses have the New Jersey State Nursing Association, the collaborative is designed to be a doula professional home, providing space for community doulas to connect, learn, and grow. Serving as a critical intermediary between doula services, hospital systems, and government support. Better yet, the collaborative is doula informed, in that doulas have been and continue to be involved in every step of the process. The collaborative can build on the partnership established between doulas and government. For example, during the COVID-19 pandemic, many hospitals, due to safety concerns, restricted birthing people to having only one person in the hospital with them, forcing many to choose between their partner and their doula, effectively shutting out one of the most important advocates for the birthing person. Collaboration and open communication between government and doulas led to an executive order from the Commissioner of Health that reclassified doulas as part of the personal care team, thereby allowing them in hospitals to provide birthing support. This could not have happened without the partnership that has been established to date, connecting doulas, hospital systems, and government. This is the type of impact we envision the collaborative can build upon and continue to achieve. To date, 80 doulas have been trained who've assisted in over 525 births in 4 cities across the state. We hope this professional home will build this statewide workforce exponentially and provide ongoing support to community doulas from here on out. We expect to have an organization seated by July 1st but know the collaborative will need additional support and resources to fully thrive. Our ask is for strategic partnerships and connections to organizations that can help raise awareness of community doulas, the importance of this doula professional home, and funding to ensure sustainability of this work. Let's ensure that community doulas have a professional home that has their best interests and development at heart.
Thank you to Lisa. Now you'll see a pop-up where you can get connected to Lisa and her team to learn more about the Doula Learning Collaborative. Next, I'd like to introduce Steve Carries from Integrated Care for Kids, which is working to dramatically transform the experience of children and families served by Medicaid. Here's Steve.
Hi, I'm Dr. Steve Carries. I am a pediatrician and the principal investigator for the Integrated Care for Kids, nicknamed INC, program. INC is a transformative model to improve the health of all children receiving Medicaid by yearly assessments of physical, mental health, and social needs, and then ensuring the children receive the support they need. First, a family story. Jose and Marie are parents in my community. Their child, Christine, has delays and seizures. Their primary care doctor closes at 5, so they use the emergency room regularly. They cannot afford daycare, so they work different shifts. They work with various agencies that often contradict each other. They are left trying to navigate care on their own. Their story is one of thousands, kids from families with strengths, but often in crisis. The services they receive are siloed, fragmented, and often redundant. We are not going to make a difference one program at a time, one brick at a time. We need to build a whole new home. We believe we've developed such a model, one that provides radical change that is also doable and sustainable. INC's model cares for the whole child. In our case, 130,000 children from diverse families receiving Medicaid in 2 counties in New Jersey. INC puts the family at the center of a viable community-wide process that eliminates the redundancies and the fragmentation. INC's Partnership Council gives community agencies a voice in the model, aligning these groups on shared services and shared data. Medicaid is our partner. We launched the new model in January of 2022 and monitor results over the next 5 years. How does INC work? We make sure that every child gets screened regularly for medical, behavioral, and social needs, and use the screening to identify children and families in need of help. We develop a community electronic data system that takes the child's records from schools, from medicine, mental health, and from the community and makes them accessible, all done with the family's permission. We ensure that community services communicate and work together. We provide extra care management for children most in need using community health workers and social workers. Medicaid is implementing an alternative payment method to pay for this approach. Medicaid allows us to leverage additional investment and gives us a path to replicate and to scale. We are seeking $250,000 to fund and train 2 teams of social workers and community health workers. This will allow us to hit the ground running. By mid-2022, the new payment model will make your investment quite leveraged and setting the stage for statewide transformation beyond the 2 counties. Please help us break the cycle of only fixing one brick at a time. Help us build the new home that so many families desperately need.
Thank you, Steve. You can use the pop-up to get connected and learn more about INC's ambitious programs. Great. I see we already have 50 folks requesting connections. Super. Thanks so much. We're glad to see everyone participating, getting connected to organizations you're seeing today. Next, we're going to meet Liz Savino from the InHome Recovery Program, which is doing life-changing work to help families recovering from substance use challenges. Here is Liz.
Child Protective Services often removes a child from a parent who has a substance use disorder. But what if it turns out that keeping the family together is best because it reduces children's exposure to adverse experiences and motivates parents to achieve recovery? I'm Liz Savino from Preferred Behavioral Health Group, and I work in Ocean County, New Jersey, which has long been a county at the forefront of the opioid crisis. Our death rate is twice the national average, which is why the In-Home Recovery Program, or IHRP, was started here. Let me tell you about Nikki and her in-home recovery. At 28, she had used heroin for half of her life. She was pregnant but didn't know it until 7 months. Emma, her newborn child, was 1 week old when we met her. She was Nikki's reason to seek help, and she's been her motivation to abstain ever since. For 10 months, she really stayed on track, but she had a relapse and was arrested. CPS didn't remove her child because she was in our program. In a few weeks, Nikki was on the path back to recovery and was able to obtain housing, daycare, and now also has a full-time job. That is how IHRP can change lives. Emma saved Nikki's life. Here's how IHRP and Nikki work together to help her reach her treatment goals. A substance use clinician engaged Nikki in individual therapy. A parent-child therapist met with Nikki and Emma and helped build an understanding of Emma's developmental stages and needs while encouraging a strong parent-child attachment. A family support specialist worked with Nikki to access community services. Nikki was very engaged in our weekly therapy group called Social Club. She and Emma attended each week, met with other moms facing similar challenges, and felt supported while offering support to others. As Nikki's story highlights, parents can achieve recovery while parenting. IHRP is adapted from an evidence-informed model that was started in Connecticut in 2007 by the Yale Child Study Center. Connecticut now has 13 treatment teams which have served more than 2,000 families. IHRP has been piloted for over 1 year in New Jersey and has served 30 families. Most of these parents have achieved successful discharge, and 29 of the 30 children are still living with their families. The New Jersey Department of Children and Families has seen the benefit of this innovative program and has awarded us a grant to continue the program for 1 year. We will have the ability to serve over 24 new families. We're so excited to be able to continue this journey and to be able to draw on the 14 years of experience in Connecticut. But the need for a program like this is broader than what the two teams can provide. We are seeking funding to build additional treatment teams beyond Ocean County to support caregivers and keep families healthy and together throughout the state. I'd like to leave you with these guiding principles: that parents do achieve recovery while parenting, they can change and have hope for the future of their family.
Thank you, Liz. We invite you to connect with Liz to learn more about the In-Home Recovery Program and help sustain and grow their work. Next, we'll meet 3 organizations that have a special focus on addressing the social determinants of health in communities. Our next speaker is Neighborhood Connections to Health, which has taken an inspired, community-driven approach to addressing key issues impacting health and well-being in their community. Here is Executive Director Linda Brown.
Hi, I'm Linda Brown, the Executive Director for Neighborhood Connections to Health, or NCTH. We're a coalition of more than 150 partners and community residents working to advance a culture of health in Freehold by addressing critical social determinants of health that impact the quality of life. Over the past 30 years, Freehold Borough has seen a significant shift in its population. moving from a predominantly white community to a more diverse demographic, including Hispanic residents and a significant undocumented population. Tensions with changing demographics have led to bigger gaps in health outcomes, access, and wealth. Language, cultural barriers, and lack of trust keep the most vulnerable from taking advantage of existing services, which jeopardizes the health and well-being of the community. NCTH is grounded in Freehold and works with residents as partners, not for them. We meet with people in culturally appropriate ways to solicit feedback on needs, challenges, and well-being, and we work with them to turn that feedback into action. This process is critical for building trust and an empowered community that takes ownership of their health. Engaging in this process led the community to identify 4 key focus areas to address social determinants of health and positively affect the future health of all residents: healthy food access, bikeability, walkability, lead poisoning prevention, and intergenerational and cultural interdependence. So, what's our superpower? We are an integrator. So what does that mean? There are 3 things. First, we set the model for how to work with a linguistically and culturally diverse community. We have demonstrated how to effectively serve our Hispanic population by taking small but critical steps to build trust, such as providing live translation in Spanish and creating Spanish language materials for critical community services and programs. Second, we break down decade-old silos to improve impact by helping services work better together. For example, previously, many organizations provided food but worked independently and often duplicated efforts. NCTH has successfully brought together 15 partners to better address the community's healthy food needs through collaborative efforts, which identify and fill gaps. During the pandemic, this group worked to raise $27,000 and serve 3,200 meals to students and their families over spring break, a feat that had never been done before. And last, we bring together the community and critical stakeholders to make real change by advocating and taking action. We are proud to share that through this advocacy work, Freehold Borough is the first community in New Jersey to pass a lead-safe ordinance. Our level of trust and impact in Freehold is so great that many of the people who receive services are now volunteering with us to give back. Empowered community members are the future of this work. By working with the community and mobilizing partnerships to address the social determinants of health, we are building a culture of health in Freehold Borough. Our hope is that other communities can replicate our model in the future. We're looking for a long-term partner to invest in us and help us continue building this model of equitably improving health outcomes in our community. We look forward to sharing more of our work with you. Thank you.
Thank you, Linda. Now you can click yes on the pop-up to get connected to Linda and her team at Neighborhood Connections to learn more. Next, we'll meet Kristen Traba, a pediatrician and the co-leader of NJ-PRAC, which is building a statewide core of pediatricians equipped to understand and address the social determinants of health in their communities. Here is Kristen.
Hi, I'm Kristen Traba, a pediatrician in Newark, New Jersey, and co-lead of the New Jersey Pediatric Residency Advocacy Collaborative, NJ-PRAC, a collaborative of all 9 pediatric residency programs in the state. Our mission is to ensure that every pediatrician has the knowledge, experience, and skills to address social determinants of health in the community. Research shows that preventative interventions targeting social determinants of health, such as education, safety, and income security, can account for an 80% reduction in disease or death compared to clinical care at 20%. Despite this, pediatric training programs have traditionally focused on preparing pediatric residents in clinical care. NJ-PRAC is addressing this gap because we know training regarding social determinants of health is essential. NJ-PRAC is focused on addressing this gap in training in 2 key ways: authentic community engagement and development of core resident training. We know that in order to understand and advocate for their patients, pediatricians must find points of meaningful connection to their communities. To teach pediatric trainees how to engage in meaningful community partnerships, NJ Pratt linked each residency program with a local family success center, which offers free wraparound resources and programs for families. In partnership with the FSC staff, pediatric faculty and residents develop tailored educational programs, and in return, residents learn about resources provided by the FSC. Every resident saw the power of a strong community partnership when COVID hit New Jersey. FSCs quickly connected with NJ Pratt, sharing the community's overwhelming fear and anxiety with the onset of the pandemic. We partnered to develop a virtual Ask the Docs series to address community's concerns. This highlighted the importance of these reciprocal relationships with community-based organizations and was recently published in the journal Pediatrics. Our resident training includes a statewide parenting curriculum, providing all pediatric residents in New Jersey with a foundation to help families build stronger parent-child relationships. Because we know that especially in the early years, responsive caregiving and positive attachments are extremely effective in mitigating social determinants of health. We also train all residents in assessing the local community through a windshield survey. NJ Pratt is actively building a strong foundational core of pediatricians who can advocate for their communities and ultimately improve health outcomes for children across New Jersey. The collaborative impacts over 200 future pediatricians every year who will be caring for New Jersey's children and teaching future generations of pediatricians the skills needed to better serve the community in addressing social determinants of health. We need your support to sustain the current community programs, to expand our reach in the community and curriculum offerings, and to evaluate and increase the impact of our work. Thank you.
Now you can click yes to get connected and learn more about NJ Pratt's work. Next, we'll hear from Kathy Dodsworth of Rutgers Project Echo, which is taking on some of the toughest challenges in New Jersey with their innovative and effective problem-solving communities. Here is Kathy.
Hi, I'm Kathy Dodsworth, the Executive Director of Rutgers Project Echo. Project Echo is a grant-funded educational program that builds learning communities among healthcare and frontline providers to address critical health issues such as infant mortality, diabetes, adverse childhood experiences, opioid addiction, and COVID-19. We solve for these big problems by bringing together doctors, nurses, social workers, behavioral health specialists, educators, and community organizations in a virtual environment. They share expertise and problem solve for real-life patient and client situations. This collaboration, what we call All Teach, All Learn, democratizes healthcare knowledge and increases healthcare access. Let me share an example from our Adverse Childhood Experiences, or ACEs Echo. Charlie was 16 and morbidly obese. He was often absent from school and acting out. The school counselor and his mom focused on disciplining Charlie's actions, but weren't making much progress. Charlie's pediatrician brought this story to the ACEs Echo. Participants asked questions and made connections that his school, family, and doctor hadn't seen. It turns out that Charlie was a healthy weight at 11 before his parents divorced, his mom went back to work, and he was forced to change schools. In school, he was bullied and turned to food for emotional support. Anchored in this understanding of Charlie's trauma, the ECHO members discussed the options available to help Charlie. They aligned on specific recommendations for therapeutic interventions, services, and resources for Charlie's pediatrician. This ECHO discussion had a huge impact on Charlie's life, but it didn't stop there. Charlie's story informed the practice of over 100 other healthcare providers. You see, ECHO creates a ripple effect that helps many children and families. In the last year, over 12,000 individuals and 350 local organizations attended our programs that address some of the toughest challenges in New Jersey. Participants have overwhelmingly ranked the programs high on use of evidence-based guidelines, and 94% indicated they were implementing the recommendations. We are fundraising for two of our most well-attended and topical ECHOs, the ACEs ECHO and the Diabetes ECHO. To continue these two critical programs over the next 2 years requires $1 million of funding. Consider for a moment the impact that this past year has had on all of us, and especially on our most vulnerable communities. Our ACEs and Diabetes ECHOs are needed now more than ever. ECHO can take on our greatest crises and create system-level change, but change requires commitment and resources. Please join me. Let's talk about the issues you care about and the difference you can make by investing in the ECHO community. Thank you from all of us.
Thank you, Kathy. You can click yes on the pop-up to get connected and learn more about Rutgers Project ECHO. The next three presenters are community-based organizations serving young people and families impacted by ACEs, or adverse childhood experiences, which affect more than 40% of children in New Jersey and can have lifelong health consequences. The Nicholson Foundation's grants to these programs have specifically funded training and resources for providing trauma-informed care to their communities. Our next presenter is Altarique White, founder of Leaders for Life, a program that serves teenagers in Newark with comprehensive academic, leadership, and college and career prep programs, as well as offering trauma-informed support for health and wellness. Here is Altarique.
Hi, I'm Altarique White, founder and executive director of Leaders for Life, a nonprofit organization focused on improving the quality of life and access to opportunities for disenfranchised youth in Newark. I was one of those kids. I lost my mother on October 7, 1987, at 16. I left high school shortly after. I was homeless for 6 weeks. I couldn't go home, and I couldn't go to school. I thought nobody noticed, but Mr. Wood, my English teacher, did. He found me. He got me back in school. He gave me discipline, and he gave me hope. Mr. Woods became Pops to me. I made All-State in football and ultimately to the Miami Dolphins. However, it's not how I started. It's how I finished. I tried to buy Pops a car, but he wouldn't let me. He said, "Pay it forward, Altarique. That's what we're about." By the way, the school I dropped out of, I became principal of it. The reality is that the overlapping challenges of low rate of employment and high levels of poverty paired with the current pandemic are overwhelming our community. Instead of being in a position to pass down wealth, societal issues force families in the South Ward to pass down trauma. So we set out to make the next generation is supported and have a better chance. Leaders for Life takes a holistic approach to programming. We serve children, their families, and the communities they live in. In 2008, our work began with 35 young boys who we paired with caring and responsible adult mentors to provide support and advice. Now, 350 kids, age 8 to 14, participate in our after-school learning and enrichment program while having a healthy meal and a nutritious snack. And our summer program provides academic and social-emotional enrichment during the summer months. We expanded our services to combat adverse childhood experiences by incorporating social-emotional learning into our daily work. The middle school transition to high school program is designed to successfully assist students as they transition to high school by providing realistic expectations for the next chapter in their academic lives and supporting them through the process. Leaders for Life Academy is our alternative high school. We work with students to increase their levels of literacy and mathematical skills. Increasing their skills in these areas allow them to be more employable to combat poverty. Our partnership with Job for America's Graduates provides training so our youth are able to create resumes, participate in interviewing skills, and expose students to job readiness workshops. For community members, our Center of Hope is a connector to city services. We provide masks, food, health webinars, educational forums, and clothing. Leading for Life have impacted the lives of 32,000 children over the course of 13 years through mentoring and services. Leaders for Life Academy has graduated 141 students since its inception. We're looking for partners to help us grow, double our impact to serve 1,400 families, increase our tech ability for virtual outreach, onboard and train staff to support growth. We're all in. Are you?
Thank you, Altariq. You can use the pop-up now to get connected and support Leaders for Life in Newark. Next, we'll meet Anna Obika, Director of the Futuro Familia program within LALDEV. The Futuro program equips young people with critical support for succeeding in college and beyond, and also crucially supports the parents who are embarking on this unfamiliar journey to college with their children. Here is Anna.
Hello, I'm Anna Obika, and I work with the Futuro program in Trenton, New Jersey. And I want to start by sharing an inspirational story with you. Luis Gasca, currently a senior at Rutgers studying environmental and business economics. He will be graduating in May 2021, debt-free, and has already accepted a full-time offer as a financial analyst with JP Morgan in New York. These are his words. Futuro has been one of the most impactful factors in my life to have got me to where I am today. Organizations like LALDEV and the Futuro program empower the youth of Trenton and give them the catalyst they need to overcome barriers that have been set on us. The Futuro program is an inclusive and diverse youth mentoring program for first or second generation immigrants from an ethnic cultural background and undocumented students in Mercer County, residents of Princeton or Trenton, family income at below 80% of the area median income, determined to go to college with a GPA of 3 and over. How we support our students. Futuro students are supported by individualized mentoring and tutoring, assistance with college and scholarship applications, resume development sessions, volunteer opportunities, a stipend for laptops or books. How we support the whole family. Futuro Familia was launched in 2019. It's a parent cohort that allows ongoing support, education, and guidance in their students' college journey. Workshops for students and their parents on health, stress management, financial literacy, and personal development. Our success, 100% high school graduation rate for more than 300 Futuro participants since 2011. Over $2 million in scholarships for the class of 2020. Futuro alumni now work in finance, medicine, education, and for the U.S. Congress. Students become leaders that give back to their community. We need your commitment in order to grow and sustain the Futuro program. Your support will help us with permanently embedding Futuro Familia that is so needed into our program, helping us cover fees for undocumented students, and funding for such a need of an ACE-informed professional counselor to support our families with issues of trauma, poverty, acculturation, and assimilation. We know it takes a village to raise a family, and we invite you to be part of ours. Mil gracias.
Thank you, Anna. You can click yes to get connected to LALDEF and learn more about Futuro Familia. Next, we'll hear from Alicia De Lorenzo from Garden State Equality, who's pioneering a new approach to addressing the trauma of ACEs and breaking cycles of pain and hardship. Here is Alicia to introduce you to this new work in Asbury Park.
Garden State Equality is New Jersey's largest LGBTQ organization. Since 2004, we've focused our efforts on education and advocacy to bring equality to all in our state. We know that trauma underscores so many of the lived experiences for folks with LGBTQ and multiple marginalized identities. It's a social justice issue that we're committed to addressing, starting in our very own city of Asbury Park, New Jersey. Despite being a small city by the sea, our 1.1 square mile town experiences big city problems. Youth in Asbury Park are regularly exposed to violence, poverty, gangs, and substance abuse. And consistent with national findings, LGBTQ and BIPOC youth are more likely to experience multiple ACEs in childhood that can have lifelong, even generational consequences. But we know our history is not our destiny. There are those who have discovered ways to thrive. Starting in 2020, folks throughout the city have come together to use a proven framework called positive deviance, a strength-based approach with one main principle in mind. In every community, there are individuals whose uncommon practices enable them to achieve better outcomes than their peers with the same resources. The positive deviance process follows the following 4 steps. Define the problem and desired outcome, identify positive deviance, discover their practices, and design practice opportunities. With 30 years of proven effectiveness around the globe, these 4 steps have reduced malnutrition, infant mortality, and more. We are confident positive deviance will move us closer to a self-healing community. This past year, we have engaged over 200 stakeholders, including residents, city council, faith leaders, parents, teachers, and first responders, with opportunities to become knowledgeable about ACEs and the positive deviance process. Together, we've begun applying the same 4 steps. We've defined the major problems facing our youth: early abuse, neglect, and community dysfunction, and our goal of reducing the rates of these challenges for future generations. We are beginning to identify just who the positive deviants are in our community. Who is thriving despite these challenging circumstances? Our next steps include discovering the uncommon practices that interfere with trauma, then designing and implementing practice opportunities to build greater community resiliency. We don't know the specific solutions that will be uncovered, but we look forward to the community-revealed insights that will lead to lowered rates of abuse and neglect, improved relationships and community connections, and reduced ACEs for current and future generations. And our early work is promising. It was recently highlighted in the governor's ACEs statewide action plan, and we're looking forward to replicating this model in communities across the Garden State. We are just getting started with the hard work of sustained change, but our current funding only lasts through May. This has been a challenging year. Are you ready to be part of hope-filled healing? We can't do this without you, and are looking forward to your support.
Thank you, Alicia. You can click yes on the pop-up now to get connected and learn more about Garden State Equality's self-healing community. Finally, for our last 2 presentations, we're going to hear from 2 organizations working statewide to ensure access to high-quality early care and education experiences for all children in New Jersey. First, FEA has decades of history improving K-12 education in New Jersey, and today you'll hear about a powerful new initiative they've undertaken to improve early childhood education across the state. Here is Dr. Mary Reese.
Since 2015, New Jersey has funded the expansion of full-day preschool in 120 school districts. But many principals who are leading these programs lack the preparation needed to create high-quality experiences for our youngest learners. I'm Dr. Mary Reese, a former elementary school principal, and I am most passionate about early childhood leadership. As the project director of the Transforming Early Childhood Leadership Institute, I am thrilled to share our approach to addressing this training gap for school and teacher leaders. As we review the landscape of professional learning for early childhood educators, we quickly realized that there were no programs that focused on the alignment between preschool through grade 3. Without this alignment, early childhood programs are at serious risk of causing learning loss for children and confusion for their families. Our project fills this void. The Institute brings together teams of principals and teachers to explore early childhood concepts in a safe learning space. Our customized curriculum, created by a team of experts, including staff from the State Education Department, is aligned with best practices, particularly those from the National Association of Elementary School Principals and the Professional Standards for School Leaders. It features quarterly all-day sessions, monthly coaching meetings, and related workshops. To date, we have trained more than 300 leaders and teachers from 50 schools. As a team coach, I witnessed significant gains which were confirmed by an external evaluator. Participants incorporated developmentally appropriate practices, enhancing their classrooms as joyful learning spaces. Educators prioritize play, student choice, and family engagement. Teachers began cross-grade conversations about curricular alignment, and principals partnered with teachers to celebrate best practices for early learners as the norm, not the exception. Adapting to the pandemic, our teams transferred learning into successful virtual experiences for their youngest students, and they developed an informal community of practice to share strategies for virtual learning. As New Jersey Governor Murphy mentioned in his recent budget address, pre-K is one of the smartest investments we can make in our future. We see the investment returned more than 7-fold throughout youngsters' lives. And the research demonstrates that an aligned preschool through grade 3 system is an essential ingredient in fulfilling that potential. Momentum is growing for this unique form of professional learning, and we hope to show other states how they can implement our model. We have already received requests from 50 additional districts, which far outstrips our capacity. We seek financial support to expand this institute. We also seek like-minded research partners who are invested in quality preschool through grade 3 alignment. Our goal is that all children have access to a great early childhood experience.
Thank you, Mary. And please click yes in the pop-up if you'd like to get connected and learn more about the Institute. I'm pleased to introduce our last presenter, Allison Friedman-Krause from NEAR. NEAR has long advocated for children in New Jersey, and today they'll highlight an opportunity to get involved in their latest work. Here is Allison.
For far too long, we have undervalued the education and care needs of our infants and toddlers and their families. The pandemic has made it even more obvious that the childcare system is not meeting the education needs of our youngest learners or the care needs of their parents. So now, as we reimagine and rebuild, it's time we prioritize investments in our infants and toddlers. At NEAR, the National Institute for Early Education Research, investing in young children means providing policymakers data and expert analysis to formulate early education policies that improve children's outcomes. But right now, we can't answer basic and critical questions key to driving policy change. That's why NEAR launched the new Infant and Toddler Policy Research Center to bridge the critical data gap needed to advance effective policy for infant and toddler education and care. I'm Dr. Allison Friedman-Krause, Director of ITC at NEAR. I'm also a mom with an infant and a toddler. I have firsthand experience of the value of high-quality childcare for my 2 boys. ITC at NEAR conducts policy research to advance high-quality education and care that supports the development of infants and toddlers. Our independent and rigorous research stands out through our unique focus on infants and toddlers, on education and care, and on local New Jersey research. Our first research products will focus on high-impact, actionable questions like, why is the use of childcare subsidies so low? We'll also collect data on basic questions like which infants and toddlers are accessing different types of care, and who are the caregivers? We'll address foundational questions like how can we improve access to high-quality education and care? We will work with our partners, policymakers, advocates, and practitioners to identify research gaps, advance our research agenda, and disseminate findings to the media and policymakers. Through this work, ITC at NEAR will be the catalyst for fact-based policy change that improves the lives of young learners. We know we can do this because we've done it already for preschool. For 20 years, NEAR has been a go-to resource for state and federal policymakers. In New Jersey, our evaluation of the state's preschool program showed positive effects on student achievement through high school and directly contributed to the state's current preschool expansion. Our National State of Preschool Report has been an advocacy tool in multiple states, leading to preschool expansion and quality improvement around the country. Imagine what would happen if ITC at NEAR could similarly impact outcomes for 0 to 3-year-olds. More infants and toddlers will be better prepared for preschool. Developmental challenges can be identified earlier and interventions can begin sooner. And parents can enter or stay in the workforce and contribute to the economy. There is no time to lose. We have the opportunity to impact children's futures through high-quality experiences in the first 3 years of life. But we need a community of funders to sustain our work for the next 3 to 5 years. Babies grow up fast, and as every parent knows, the days are long, but the years are short. That's why we must move this work forward now. And with your support, we will. Thank you for your time.
Thank you, Allison. You can use the pop-up now to get connected to Allison and ITC at NEAR. I see those connection requests coming in. We're so thankful for this community. We just heard from 12 passionate and committed individuals who are relentlessly working to make change happen through impacting healthcare systems, through addressing social determinants of health, through transformative programming for young people in their communities, and through ensuring high quality care and education in the earliest years of life, when we know interventions have the potential to make the greatest impact. As you reflect on what you saw, if you have any thoughts you'd like to share on the experience of Show and Tell, any ahas about the collective impact of these programs, ideas you're excited about, or burning questions that you want to get out there right now, we invite you to share those in the Zoom chat. If you choose to send your comments to panelists and attendees in Zoom, then everyone in the room will get to see them. Unfortunately, we won't have an opportunity to address and engage with those reflections right now, but we will look forward to taking them in later, sharing them with the presenters or the community where appropriate. We really value the opportunity to learn from the wisdom in this room today. Of course, we know that this is only a slice of the innovation happening in New Jersey, and we welcome connections to more programs and experts doing great work in the area. Among the presenters you saw today, we hope you chose to connect with many of them. And if you didn't do so yet, now is a great time to do it. You can visit the follow along webpage at this URL, remind yourself of the presentations you just saw, you can watch them again, and use the connect links on this website to request connections to the organizations. You can also use those links to share feedback and other requests and be part of the incredible progress that these organizations are driving now in New Jersey. I wanted to let you know you can also watch recordings of our other show and tell programs on the Promise Venture Studio website. In the past year, we've covered central early childhood topics like supporting parents in the earliest years, COVID innovations in early childhood, the supply of high quality childcare, and social emotional well-being in the early years. We also have an upcoming program on equity and justice in early childhood. When you watch any of the past programs on our website, you can use the tools on the site to get connected to those organizations represented in prior show and tell events if you'd like. Now, before we wrap up, we'd like to take a moment to thank the incredible team at the Nicholson Foundation for the work that they do on behalf of children and families in New Jersey, and for this opportunity to partner with them on Show and Tell. To those of you in the audience, thank you for joining us today. And please remember that this is just the beginning. We'll email you contact details for all of the organizations that you flagged today. And you can also expect to hear from the presenters themselves in the next few days where you requested connections. Please lean into those connections, ask questions, share your feedback, and schedule meetings with those that you'd like to explore supporting further. Lastly, to our extraordinary speakers who began preparing for this event months ago, we thank you for the thought and care and dedication you brought to your show and tell preparations. And above all, we thank you for your truly inspiring work, which fills us with optimism for the future. New Jersey and the country are fortunate to have you. With that, we are pleased to end a few minutes early today to give you a chance to reflect on what you heard here, to consider the role you want to play, and maybe to make your first connections right now. Thanks, everyone, and goodbye.